This is Rise. Let's lock in with the goal of changing one life at a time. Yours. Together, let us rise up, inspire, strengthen, and elevate our minds. It's time to Rise on the voice of Nassau Community College, 90.3 WHPC.
Hello and welcome to Rise. My name is Dr. Saran Heron. Today we are going to talk about overcoming challenges in professional licensure after college and how you can rise above those challenges. My guest today is Kerry Ann James, a radiologic technologist at Radiology Regional in Southwest Florida. As a mammographer, she graduated from New York City College of Technology. She is here to tell us about the challenges she had in preparing to take her licensure exam, and exam stress is something I am sure all of us can relate to. Kerry Ann, welcome to Rise here on the voice of Nassau Community College, 90.3 WHPC. So tell us about yourself, your background, your career, your degree. What led you into this career path?
Thank you for having me on today, Dr. Heron. My name is Kerry Ann, and I am a 25-year-old Brooklyn born and raised. I am the daughter of a Jamaican immigrant and the first in my immediate family to graduate with a college degree. When I was in the 7th grade, my late mother, who was diagnosed with colon cancer, went through radiation treatment. As she went through the radiation treatment, she would take me with her just as a support system to go through the process. Of course, we know that this is a very trying process and it could put a lot of stress on you. As she would take me, I would sit there and I would eat sandwiches, just trying to pass time as she's inside. And I realized that this is a field that I was interested in. So now bringing it back to today, I am a radiologic technologist who is certified in X-ray and mammography. And I do carry a bachelor's of science degree in the study of radiological science.
That's really interesting what led you into this whole career path. You never know, right? So how did you handle studying for your licensure exam after college?
So studying for me was very difficult, from dealing with changes that were occurring in the world like COVID to just having personal changes as far as me relocating to another state, which is now the state of Florida. I kind of struggled to find a balance between dealing with all these things that were going on in my life and studying. After graduating from college back in December of 2020, I immediately packed my things and relocated to the state of Florida. Once in Florida, I did take 2 months to study and go through all things that I learned over the course of 2 years. When it reached the week before my exam, I did go through all the information one by one again, just to make sure that I was prepared for my exam.
Excellent. So do you have a favorite story about why you knew this career path was your passion?
So I always knew that I wanted to be in the medical field. I just didn't know which path was mine. So I knew that this was my passion when I would show up for my clinical portion on time. One thing about me, I am never on time, and everyone that knows me know this. So when I noticed that it wasn't difficult for me to get up, it wasn't difficult for me to get ready and leave the house, reach on time, and of course, finding parking in the busy streets of New York, I knew that this was for me. Also, I did have a case where this day of clinical, it was 5 back-to-back traumas. It was very busy. Everyone was running back and forth. But throughout that time, I felt happiness within me. So I knew that this field was the greatest choice that I could make in my life.
So any experiences that stand out? You kind of touched on it a little bit. Do you want to go in a little bit more?
So I was, my first clinical location was a level 1 trauma center, which is located in Brooklyn, New York. This day, a patient came in with bed bugs. So I did question if this field was mine because I was so terrified. But We got suited up in our PPE. We made sure that our machine did not enter the room in which the patient was because she was isolated. And we were able to go through the exam, and we cleaned up, make sure that nothing touched anything else to infect it. And once I realized that, okay, I was able to overcome that challenge that I thought I couldn't, I knew that this was it.
So in addition to becoming a radiologic technologist, how did you stay motivated during college?
I stayed motivated by knowing that although I am going to go through obstacles, difficulties, and things of that nature, that the outcome would be greater than all of that put together. So I believe that if God would not have exposed me to this field when I was in the 7th grade, if it was not something that he wanted for me. So throughout all of the testing and feeling the stress, feeling overwhelmed and everything, I would always remind myself that God placed me here for a reason.
All right. So choosing your given profession, did that present any challenges for you?
So yes, one major challenge that I went through was actually failing the physics portion of the curriculum. This was my first year within the program. We were just getting used to the workload and understanding how everything is going to happen within the program. And I believe that I took too much on my plate. When I say too much on my plate, I was still working 30 hours a week plus being a student. The program that I was in, they did warn us from the beginning that it's going to be difficult to find a balance between your work life, social life, relationships, friendships, because of the amount of workload. So for me, when I failed it, the program did let me know that that was it. You are automatically kicked out. It doesn't matter if you're 1 point away, 2 points away. And unfortunately for me, I was only 2. Wow. And that is something I will never forget. I was only 2 points away. I did have to leave the program. And in order for me to have the opportunity to get back into the program, I had to have an interview with the chair of the department. After the interview, she would take the information that she gathered from me and bring it to the board. The board, which was our 6 professors, then had to vote and decide if they wanted me back into the program. Thankfully, they did, because radiology was my plan A and plan B. I had no backup.
Wow. An amazing story as I'm listening to you and you're just walking through. Well, congratulations. You made it through your challenges. And you are listening to Rise on the voice of Nassau Community College, 90.3 WHPC. My name is Dr. Saran Heron, and today we're talking with Kerry Ann James, a radiologic technologist originally from New York, who is talking about challenges she's faced as it pertains to obtaining her certification and overall exam stresses. So, Kerry Ann, we're going to continue and just dive right, more into all this great information that you're giving me. So tell us about being a radiologic technologist. What is it all about for someone listening that may be interested in that profession?
A radiologic technologist is also known as a rad tech. And this is a person who aids in patient treatments by performing diagnostic imaging procedures. So the field is very broad. You can either focus on X-ray, which is what you start out as, or you can become a CAT scan tech, a mammographer, or an MRI tech. And the list goes on with the field. So in order to initially become a radiologic technologist, you do have to go through a minimum of 2 years of college. After the 2 years, you are able to take the knowledge that you gained and sit for a certified exam. Once you pass that exam, you are then able to go into the field. I would recommend this field of course, especially if you are interested in gaining knowledge in the bones, the organs, muscles, soft tissue, and you'll just learn things about the human body that you would have never imagined.
Wow. What lessons can you share, though, from your experience? I'm sure you have many.
So one of the many lessons that I have learned, and this one is the most important to me, and I would believe to everyone, is to just always focus on your mental health. If you are not mentally stable, it's going to be very difficult to go through this program. It's 2 years. And in those 2 years, you're learning so much information and it could just take a toll on you. So I would say that always focus on your mental health. If that means that you need to take a day off from studying, just go outside, have a little fun, take a walk in the park. If you want to go away for a weekend and travel, just to get your brain back together to come back and take in some more information, you should do just that.
All right. So have you experienced a different outlook on your profession now that you have been in the field?
So yes, if you were to ask somebody what is a radiologic technologist, more than likely they would tell you that the field is full of people certified to push a button. After you are in the field, you know that it is not just pushing a button and taking a picture. You are dealing with radiation. This radiation can literally alter someone's life if it is done incorrectly. If you're giving out too much radiation, it can affect the body negatively long term. Whereas if you are giving too little radiation, you are actually not presenting a diagnostic image. So you would then have to repeat your image, and that will cause the patient to go home with double doses of radiation. So now that I am in the field, I understand firsthand that we aren't just button pushers. We are literally helping save lives within 10 minutes of an exam.
Wow, you're teaching me some things. So do you have any tips for college students who are worried about exam and the licensure after college?
So I do have a tip for you guys, and that is just to take the first step. Once you take the first step, then you'll notice that, okay, this is for me. And once you sit in the classes and you're retaining the information, you're studying, and you're passing your exams, you'll realize that, okay, everything is just flowing naturally. And once you sit for the exam and you are able to utilize all that information, you'll realize that this is what they prepared you for.
That's awesome. So what is the most challenging part of any exam or your exam?
I would say that the most challenging part would have to be trying not to forget the information that you were taught. And I also have another one, which to me, these two tie together in a way, and that would be to not second guess yourself. When you're sitting for an exam, you're very nervous, you're not too sure, and then you get to second guessing yourself and not choosing the answer that you know you studied hours and days and weeks that's the answer. So I would say to just always follow your gut feeling and go for the answer of your first choice, because more than likely that is the correct answer.
All right. What feedback can you give now that you took the exam and, you were successful? Just to piggyback on, it's very similar to the question I just asked.
Yes, I would say to breathe and take your time. The exam was created in a way that they know how long it should take the majority of the people sitting for the exam to complete it. So you do have more than enough time, and you were given that knowledge over the course of 2 years. So it can become very overwhelming because you're thinking, how am I supposed to remember all this information that I was given over the course of 2 years? But once you sit there, you breathe, you take little breaks in between, everything will just come right out and you'll pass your exam.
All right. What did you enjoy learning the most in your program?
So for me, I am a very hands-on and visual learner. So my favorite class was procedures and positioning. In this class, we were able to learn how to position the hand, how you should place your x-ray tube or even your mammogram tube, how you should place these things, and how to take the picture. You learn that there are different parts of the bones where if you touch the body in a certain way, you'll be able to find that bone. And what interested me the most and what I enjoyed the most about this class was that after we learned it in the classroom, we were able to take that and actually take pictures in the real world when we were placed in hospitals. And just seeing how we can go from being in a classroom learning out of a textbook to actually doing these same things on actual humans, it was just enjoyable for me.
Sounds like a great career to pick. So how do you handle feedback and criticism as it related to radiologic technology program? What feedback have you received?
So to me, criticism is very important, especially if you're someone who wants to progress in life. I am a believer that you are able to use the feedback in a positive way to improve your skills. So one feedback that I did receive as a new graduate in the field was to always speak up. And speaking up would show your patient that you're confident in what you're doing. You know what you're doing. When you're speaking lowly, the patient tends to lead the conversation. And sometimes you can stray away and not be focused on the exam at hand. So me learning that very early in the field, it actually cut down my exam time. At first, I was doing exams in 20 minutes, but now I am able to do exams in 10 minutes and faster because I am now speaking up and showing that I'm a confident radiologic technologist.
Amazing. So do you have any future plans to go back to college?
I do have future plans of going back to college. In the future, I would like to become a professor and or a teacher in a hospital-based program. So in order for me to do both those things, I would have to go back to school for my master's degree. And that is something that I am looking into at the moment.
That's wonderful. So you are listening to Rise on the Voice of Nassau Community College, 90.3 WHPC. My name is Dr. Saran Heron, and today we're talking with Kerry Ann James, a radiologic technologist originally from New York, who is talking about challenges she faced as it pertains to obtaining her certification and overall exam stresses. So are you currently working on anything in the field that you want to share with us?
So at the moment, I am not currently working on anything in the field. I am actually a newly certified mammogram tech, and I was certified back in March of 2022. So at the moment, I am just trying to perfect my craft and learn easier ways to position patients and easier ways to complete my exam. That way, when I do become a professor or a teacher, I am able to utilize those little tips and tricks to help the students.
So, Kerry Ann, what are some qualities and talents needed for your job, your specific job that you do on a daily basis? So, Kerry Ann, as we're wrapping up the program, I'm just thinking, what qualities and talents do you think you need for the job, for your job that you do every day?
So one quality that I believe that you need in order to be a radiologic technologist is to be a people's person. This job, you are very hands-on, you are dealing with patients every day, and you are dealing with multiple patients every day. So you do have to come in, be positive, forget everything that's going on around the world, and just focus on you and the patient. Dealing with patients, you never know what they're going through. So when they do step in for their exam, they're looking to you as a support system because their family members aren't able to be in the room with them. So if you come in with a positive attitude and, talk to them and communicate and ensure them that you're here if they do need you throughout the 10 minutes, it makes a difference in their life, in their treatment. They're able to leave you and go to the next person with happiness inside of them.
So from your experience, do you remember any toughest situation that, you experienced with a families, or just having to do your work and knowing you still have to do it, but it was very tough for you?
So as a mammographer, we are usually the first line of the healthcare system that is able to detect breast cancer. A mammogram is very important in detecting breast cancer. So normally we would see it firsthand. And being on the job, you see the image, but you can't show the emotions that something is wrong. You have to wait until the doctor speaks with them. And sometimes we aren't given enough time to process the fact that this patient potentially has breast cancer, because we do have 5 more patients down the line. So I would say that is something that is very difficult for me, because it's kind of like I'm putting a mask over my emotions just to continue doing my job for the rest of my shift.
I definitely agree. That is pretty hard. What's one thing you want to leave with us when it comes to college students studying in the field of radiology?
So one thing that I would like to leave with you guys is to always follow your dreams. Don't let any obstacles become bigger than your dream. Always remember that the reason why you were led into the field of radiology, and use that as a motivation to continue when times are rough.
Great. And where can we get information about your college, your program, or if we needed to contact you?
So for more information about my college, which was New York City College of Technology, which is located in Brooklyn, New York, you can visit their radiology program on their website. This website is www.citytech.cuny.edu/radiologic/. So again, that is www.citytech.cuny.edu/radiologic/. And if you guys would like to contact me, you can follow me on Instagram, and that is @_Kerry Ann J. Once again, that is @_KerryAnnJ on Instagram.
Thank you for being here, Kerry Ann James, who's a radiological technologist, works at Radiology Regional in Southwest Florida as a mammographer. Warm welcome to International Prayer Institute, Inc. We have evangelist Camille James. I know you listened in on today's program. And can you offer some encouragement to college students listening in?
Thank you, Dr. Heron, for having me here. It is a pleasure to be here on the broadcast. And I just want to say to all our listening audience, and especially to the college students, that in life, there are going to be obstacles, there are going to be challenges, but, you got to remember that there is greatness that lives inside of you. You can overcome, you can push forward. Sometimes things happen from an early stage, as we have heard with Kerry Ann, that she lost her mother at an early age, but she had a fight inside of her. The fight that she has, you have the fight also. You can push forward, press towards that goal. And when you do that, and you have a supportive background, you have your professors, your teachers, you can do all that you were created on this earth to do. So blessings to each and every one. Thank you, Dr. Heron.
We appreciate you taking the time to speak with us, Kerry Ann, and we wish you all the best of luck with your future work. And we're so glad you were able to rise above those challenges and become successful. Thank you, Evangelist Camille James. as well for joining us.
Thank you for the opportunity, Dr. Heron. We really appreciate it.
You're welcome.
Thank you, Dr. Heron.
And remember, if you believe in yourself, you too can rise. I'm Dr. Saran Heron, and I thank you for listening to this week's episode of Rise here on the Voice of Nassau Community College, 90.3 WHPC.